Welcome, everyone. I'm Denise O'Malley, and I'm the Healthy Living Maestro of You Define Wellness. And I say it that way because I'm not a healer myself. What we have is a network of incredible professionals on the healthy living journey with you. And I get to introduce you to them. So in this Apple a Day episode, it is my pleasure to introduce you to Shirley Gutkowski. I did it again, Shirley. I'm sorry, but she's with Primal in Sun Prairie, Wisconsin. And Shirley, thank you very much for joining me. And please pronounce your name correctly because we just went through this and I screwed it up.
It's Gutkowski. So there's a T and a K. I don't know why people just run through the K. Well, we got a K in there.
Well, you know,
it's all good.
I jokingly say if I transpose the letters in my name, I become Dincy, and sometimes it's very appropriate. Anyways, Shirley, it has been my pleasure to get to know you this past year. And would you share with everyone what it is that you do?
So we are a orofacial myofunctional therapy practice. So that took me almost a year to be able to say. So my son and I work together on how to whittle this down so that people know what the heck it is. So what we do is we work with the muscles in the snoring complex. So the nose, the mouth, the tongue, the back of the throat, to harmonize those muscles that open the airway, make swallowing easier, make it easier for you to breathe through the night without snoring, make it easier for you to breathe silently, to lower the respiratory rate, and to just drive health. When we're talking about health and health care, a lot of the patients that are driven to alternative methods have tried this, have tried that. They don't have a quarterback and they are always feeling, well, I don't want to say it that way. Many times they feel as though they're missing something, that some of their providers are not incorporating this or that. And very often it's breathing, and very often the breathing is interfered with by a tongue tie.
Okay,
so
I'm going to stop you. I'm going to stop you there because that was a lot of information and we're going to dive into it a little bit more. So this is a highly specialized field. How common is this to have these problems?
It's really common. Yeah. So most patients that are looking around, or most people who are looking around for different providers and different health modalities, are very often missing breathing. The incidence of poor breathing or dysfunction tongue is very high. Just look around, let's look at teeth as a beacon. Mm-hmm. When you and I went to high school, so I graduated in 1976, you probably graduated in 86 or so?
1980, my dear.
Okay, well, there you go. So how many kids in your graduating class were in braces through your entire time in school?
It seemed like there were a lot, but I don't know really because I never had braces.
Probably about 30%.
Yeah, okay, that's probably fair.
Today, it's almost 100%.
Oh, wow.
So what's been happening is that the face is becoming smaller. And we can see that because teeth are teeth and they are the size they are, but the face has to hold the teeth in. And when you and I went to high school, everybody was having their premolars removed. Well, everybody in braces. So now the orthodontist accommodated the smaller face by taking teeth out. And they never considered where the tongue was supposed to go. So now the tongue has an adult size. It's in a mouth that's the size of a 12-year-old, and there's nowhere for the tongue to go except backwards. So when the tongue goes backwards, it interferes with our upper airway, and you can't breathe, or you have a very small or narrow airway. Then you start breathing with your mouth open. When you breathe with your mouth open, you tax the jaw joint over here. It's just a really important snowball that nobody's really been taking seriously.
So somebody who's having these issues may be thinking it just is what it is and there's nothing you can do about it. Or maybe it progresses to, hey, the spouse is complaining because you're snoring too much, or you just can't seem to catch your breath. But they think that, oh, this is just normal. And
Yeah.
it's not. But if they do go seek something out, you're not the first person they go see, because they're going to turn to their medical insurance plan and they're going to go to their doctor, and the doctor's not going to know what to do, and send them to the dentist, and the dentist is going to be maybe having some solutions in there at different types. You are absolutely an alternative route for people to go. And it sounds like with your focus that you should be the first place people are going.
I very often act as a quarterback.
Okay.
Because if you don't have the arch sizes that you need to have an orthodontist involved, and you need to have a very special kind of an orthodontist. If your tongue is tied to the floor of your mouth in a particular way, that forces it also to go backwards. So you may need a provider that's going to take care of that. It may be that you have some endocrine disturbances because of years and years of snoring. So you may need an endocrinologist. So, all of these things are, how do I want to say it? So in medicine and in dentistry, everybody's been specializing. And there's nobody that's pulling all the pieces together. Even health coaches don't even think about breathing. And then also go back out again. So that's kind of where we're at. I was trained as a dental hygienist. So I graduated from my program in '86. And
how did you, and not, sorry to cut you off, but these questions are in my mind and I have to spit them out. So how did you move into this highly focused, specialized niche?
As a dental hygienist, we are trained in prevention. And that's a very niche-y place in the dental sphere. And it's against the best, how do I want to say this? It's going to sound snotty, but I think everybody knows what I mean. Dentists make money on failures, on failures of dental hygiene, right? Okay. So for me, it was always me bashing into the dentist going, I'd like to have our patients do this. I'd like to have our patients do that. I'd like to incorporate these preventive measures. And they were like, we don't have enough science. We don't, blah, 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 blah. They're not going to do it. So it was always like a head bumping thing with me. So in 2000, I started writing. And I started writing for dental hygiene publications, and then I started to be asked to speak. So this whole preventive thing and these other ways of preventing dental problems has just been always part of me. And then about 2014, well, maybe about 2010, I was like, if dental hygienists don't know this by now, I'm sorry. I'm tired of telling them. Because they could find all this information on their own. And in about 2014, I was dragged to a meeting about airway, the dentist's role, the dental hygiene team role in airway. And I found out that myofunctional therapists are in great need right now because of all the things I talked about, that the space is getting smaller. We've been, ignoring a lot of things, inconvenient truths, if you will. And so I had a jaw-dropping experience. And so I went for training like almost immediately after that. I think that meeting was in April of 14. And by June of 14, I was in a training program, took another course in December, then another course, then another course. And then in 2016, I talked my son into opening Primal Air, so that we could serve the needs of people who are looking for the root cause of a long, long list of problems.
So how do you get the word out about what you're doing?
Mostly it's social media.
Okay.
So you'll see me everywhere. I'm posting all the time in a lot of different groups. But that's mostly it. And then our next big push is the You Define Wellness site. So we have courses that we can give for HR departments about breathing, about, posture and breathing, and what to do about crooked teeth, what to do about messy eating, how to breathe through your nose, which is our best defense against all viruses forever. So all of that kind of stuff we're going to be offering through the Unified Wellness website.
Well, and your Udefine Wellness store that you have on our e-commerce platform, for those who are watching this video, you've got to go over and take a look at it because you've got some great information out. You guys are doing a good job with that.
Okay.
You're welcome. You made a comment that I want to expand on, and that you could take these classes into the workplace and working with HR managers. Why would an HR manager want to bring you in? What value is there going to be to the employees and ultimately the bottom line of the business by having their employees learn about this and pursue it?
Well,
I know, big question, sorry.
It is a big question, and it's a necessary question. It's like, what do I care if my employees are breathing? Obviously, they're getting here, so they're doing their work. But just think about what happens. Just imagine yourself as a new parent and how highly functioning your brain is during those first 6 months when you're completely sleep deprived. That's how your employees who are not breathing properly, and then that carries over into sleep, are at work. So drowsy driving is a big problem.
Yeah.
Alcohol abuse goes with sleep apnea and breathing problems at night. If you're not breathing correctly during the day, the chances of you not breathing correctly during the night are very high. And what we do is active breathing. It's not like yoga meditation breathing. You don't breathe out of this nose and then that nose, and then there's no breathing through the mouth or anything. This is how you breathe, period, throughout the entire day. And that carries over into sleep, and then you're going to be able to be more refreshed and to sleep better and get better quality sleep. You don't have to get up 6 times in the middle of the night to go to the bathroom. None of that stuff is going to interfere with the sleep. So just that alone, I think, is a huge thing. Another thing that I just wanted to throw in, because it just occurred to me like yesterday. So we're pretty high on obligate nasal breathing, so breathing only through your nose. And mouth breathing can lead to dehydration because you're losing a lot of moisture from your body when you're mouth breathing, particularly at night. So all of these people are talking about hydration, hydration, hydration. If you're breathing through your mouth most of the day and all night long, you're never going to catch up. So, I mean, it's just, stuff like that is all part of what we do here at Primal Air.
And I love everything that you said. And one thing I just want to emphasize for this, when you were talking about the employees and the value to an employer, when we do a workplace wellness talk, we call them wellness talks, we do a survey of the employees and we ask them, what other types of things are you dealing with that we can bring in subjects? Do you know the number one answer, and this won't surprise you, is sleep. And it's not that they need to take an Ambien and knock out, or a shot of whiskey or something. They are recognizing they're not getting that quality sleep, so they're not functioning at their optimum capacity in the workplace. So definitely something for HR managers when your employees are saying it, but they may not be saying it to you. They may be feeling like, oh, that's wimpy of me to be saying I'm just not getting enough sleep. There's things you can do about it. And so I love what you're doing. Now, because we have a short amount of time here, I want to jump into, you're located in Sun Prairie, Wisconsin, but is that the only place you can work with people?
No, we use telehealth. We've been using telehealth since the very beginning, since the day we opened. So we're pretty good at it. And you can be anywhere. I've had patients in Croatia. I have patients that video chat with me that are just an hour away. So we've got a global reach. We also have 6 therapists that work with us. We have a pain management therapist. we have a yoga specialist, we have a chiropractor, we have a specialist that works with the dyad between an infant and the mother, and we have Diane, who works here with us at this facility. She is a previous middle school nursing assistant. So she is very adept at working with kids from 8 to 15. So we've got everything covered.
Oh, that sounds awesome.
Yeah.
So we're getting close to the end of our time here. This is where I always like to give our providers the opportunity to add anything that I forgot to ask you about, because as you and I spoke last week, this time goes by so fast and you've been thinking of things you want to put out there. But, maybe one tip that you want to share with someone, or something that you had on your mind that you want to convey.
Well, I think probably the most topical thing I can talk about is how the gases that are produced in the nose can kill all the viruses, and we're in a really weird situation right now where everyone's afraid of breathing. And so if you can keep your mouth closed and breathe through your nose exclusively, you can reduce your chance of being infected with this crazy new thing. So
Wow.
if you can't do that, then give us a call and we can help you find a way to breathe exclusively through your nose. And even with this mask period that everybody's wearing a mask, the chances of you breathing through your nose, through your mask, are so small, and everyone's breathing with their mouth open now behind the mask. And that is just, everything's just a little downhill, snowbally kind of a thing, and that all affects you. So we can help you breathe through your nose and get through the day with a mask, breathing through your nose, so you don't end up with jaw joint problems, cavities, all kinds of things. I just brought up like 3 extra things. Sorry.
Yeah, well, no, it's all really good. That is fascinating to me, and that you brought up the mask and that you can still breathe through it. So it's, especially when we're in this time frame, we don't know how long we're going to be wearing masks, and
right.
And so it's a positive aspect to the mask issue, is there are people who can help you out. And obviously, guys, I'm introducing you to Shirley. Okay, so you want to give her a call. So for those, let me talk to the audience real quick. I just want to say thank you guys for joining this video, and I encourage you to go over to the new Wellness Center by Udefine Wellness. The link, you may have found this video in Shirley's store, and if you have, go over and take a look at her other services, read her about us, and visit some of the other providers while you're there. We've got a bunch of complimentary and free services, of which I think you guys have a consultation on there as well. And definitely we are here to help you on your path to healthy living. And I have the experts that I am bringing to you to help out with that. With that being said, Shirley, thank you so much. I appreciate you doing this video with me. I hope that we can do some more, maybe some deep dives on certain subjects, because this is all new to me. I'm a reformed insurance agent, and I learn from you guys, and I'm amazed constantly at the types of services that are out there that I never knew existed outside my medical insurance plan. So thank you for what you are doing. And that was just the timer saying our time is up. So
great timing.
Yes, and I look forward to doing another video with you soon.
Thanks, Denise.